Last one to be added to the list, yes, was KU. So that makes 5. But before we move on to the next segment or session, I just want you to hear this. There's something, as I was doing research, I came across a report that was done or written in 2019, and it was actually a parliamentary report. And it was so interesting to get to understand the status of national referral hospitals in Kenya at 2019. The year was 2019. I just want you to hear what they found because, hey, I was shocked. Hi, guys. Welcome back to A Dose of Health, the podcast, where we talk about health and health related things. And I give you not too much, not too little, but just enough health information to allow you to make an informed decision around your health. So today's episode it's very intentional. I don't think it would be fair for me, a doctor, to not explain to you a journey, or rather to walk this journey through the Kenyan healthcare system with you. Because I feel like many of us don't really understand the Kenyan healthcare system. So I'm going to try and break it down as best as I can, just so that you have a rough picture. Okay, but before we do that, of course, kawaida, a journey to inside out. So where am I emotionally? I think I would say peaceful, just because the day is winding up. The day started on a high. Anxiety was at an all-time high. I was a bit angsty, but now I think everything has calmed down and I'm peaceful. So that's the emotion I would use today. So peaceful. Okay. Then, as always, I decided that I'm going to take my friend's advice and have a segment on demystifying medical jargon for you. And one of the producers here had a very important one and a very timely one that I think I should address. It is, what is the difference between a diagnosis and not diagnose, a diagnosis and a prognosis. So, a diagnosis, first and foremost, comes before the prognosis. So it's just, a diagnosis is the identification of the condition that you have from examination and history taking, including any investigations that need to be done, including labs, imaging, etc. So it's identification of the condition that you have. Then a prognosis is a prediction of the course of the disease in relation to how you're being managed and the results. So a prognosis, it's normally based, it's a prediction, but yes, it's based on medical experience and expertise. So usually, for example, let me use cancer as an example. So a patient who has cancer and is in stage 4 versus a patient who has cancer, breast cancer, let me use breast cancer, in stage 2. So, and stage 2 not aggressive. So for us, what we would say is it's almost, I don't want to use the word obvious, but you almost tend to make that assumption that the person who's in stage 4 will not have the best outcome versus the person who's in stage 2, just because stage 4 is a late stage cancer. So prognosis is just your prediction of the course the disease is going to take based on the disease itself, but also the treatment and management options available for that disease and how you respond to the treatment. So that's the difference between diagnosis and prognosis. But always remember, diagnosis comes before the prognosis. So I have to, hey, I almost said diagnose. I have to diagnose you first. Then after that, I can make a prognosis. Okay. So let's get right into the topic of the day. So today we're talking about the Kenyan healthcare system, and I just want to walk you through that journey. So in Kenya, we have, let me use 2 main structures of healthcare services. So we have public sector and we have private sector. Public sector is mostly funded by government. It can be funded by NGOs and well-wishers. So in public facilities, everyone and anyone can seek treatment. There are no restrictions. It should be open to everyone and anyone. In private facilities, there's kind of a limitation because private tend to be for profit. So if it's for profit, I am looking at my profit margins and my losses. So there is a kind of a criteria of the people who would be able to access private facilities. And private facilities tend to be a bit more equipped in terms of infrastructure, and this includes the staff. And also they tend to be a bit more expensive. Some may say that they are more efficient when it comes to the service provision compared to the public facilities. But one thing about public facilities is they're cheaper. I think for us, that's the one thing we can say they are cheaper. And it also depends on where you are because in setups like Nairobi, you can have a public facility, for instance, like Kenyatta, which we would say is well equipped. But sometimes the infrastructure is not working. So there's a number of things that just revolve and mainly hit the public sector versus private. And that makes the difference of why people would tend to say you'd get better, not better results, but you'd get better services from a private versus a public facility. But I want us to remember, by the time you're able to answer that question of where do you prefer to seek treatment, public versus private, you're speaking from privilege because there are very many people who are not able to answer that question because the only options available to them are public facilities. So let's just walk through the Kenyan healthcare system. And at the end of it, I want us to understand that not all public facilities are bad. There are actually some that offer very good services. And there are actually some services that me personally, I would actually prefer to go to a public facility rather than private. But we'll get to that. Okay, so I asked a question on my social media just to try and gauge what my following or my community's understanding of the Kenyan healthcare system is. And let me just say, by the way, you guys did well. They did well. I was impressed, not shocked, because I know mnakonga, yeah, very serious people, but I was very impressed. So let me show you the questions I asked. So the first question was, in Kenya, how many levels of care do we have in our healthcare system? And these are the options and the percentage of people who chose the specific options. So number one was there are 5 levels. That was the answer for 40%. Number two was there are 3 levels. That was the answer for 8%. Number three, sorry, was there are 4 levels. 7% of you chose that. And then lastly was 6 levels. 45% of you chose that. So I just want, if you are part of that 45% who said 6 levels, clap for yourselves. I want you to clap for yourselves because the answer is 6 levels. And let me just explain to you the 6 levels of care that we have. So I have them here because sometimes we tend to forget these things. Number one is community health services. This includes your community healthcare workers. And I just want to go back to a time where there was the national vaccination campaign for polio. And there were many questions around someone seeing their mama mboga offering the vaccine to them. So something we might not know is there are very many community healthcare workers who their role is to offer support in the community when it comes to healthcare, but that might not be their actual 8 to 5, their actual job. It's just that when there's an initiative where they need to exercise these services, they're trained. Okay, fine. Ideally, they should be trained and they're able to offer these services. So, for instance, vaccinations, even for community based diabetic care, hypertensive care, some of these people in the community who you might see at your local market are some of the ones who actually go around finding out, have you measured your sugar today? What is your blood pressure looking like? And they're able to detect some of these things early and guide you to seek healthcare advice if you need to, etc. So that's community level. And there are many other aspects of community health level services. Then number two is dispensaries and clinics. That's level two. Level three is health centers, maternity homes, and sub-district hospitals. So now we call them sub-county. Then level four, we get to county hospitals and medium-sized private hospitals. Level five is county referral hospitals. So for instance, in Nairobi, I don't think we have one. I think, okay, Mbagathi is like one, but if you go to like, let's say, because I worked in Nyeri for a while, so Nyeri sub-county hospital, that was a level 5 for Nyeri. Then level 6 is national referral hospitals. Okay, so let me go to the next question because that one you aced, mulipita with flying colors. The next question was, how many national hospitals do we have in Kenya? This one, mulini let down just a bit. Just a bit. And in fact, someone DM'd me saying none. Hey, none. My goodness. No, 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 no. So we have, let me just answer. We have 5. So majority of you said we have 1. 31% of you said 1. You're making me laugh. But we have 5. And let me name the 5. So we have, of course, Kenyatta. We have Moi Teaching and Referral Hospital. We have Madari Hospital. Yes, it is a referral hospital, international hospital. We have spinal unit, spinal injury. Let me just get the rest because there are 5. Spinal injury, which is the other one? Oh, and the last one to be added to the list, yes, was KU. So that makes 5. But before we move on to the next segment or session, I just want you to hear this. There's something, as I was doing research, I came across a report that was done or written in 2019, and it was actually a parliamentary report. And it was so interesting to get to understand the status of national referral hospitals in Kenya at 2019. The year was 2019. I just want you to hear what they found because, hey, I was shocked. Let me just get there. Wait first. I have to check my laptop. I'm going to read word for word. These are not my words. This is the report of which you can find on the internet. So let's start with number one, because they were looking at the status of these hospitals. So this is an executive summary. In Madari Hospital, the committee found a hospital under perpetual neglect by the ministry, with its facilities run down and dilapidated. The hospital is run as a department of the ministry, starving it of the autonomy it requires to be well managed. The hospital has an acute shortage of staff, compounded by an overstretched maximum security wing whose management is left to the hospital with no requisite resources. The facility's challenges include neglected patients, many of whom lack NHIF membership cards, and even for those who use insurers, the NHIF takes too long to compensate the hospital. The hospital's land has also been encroached. Hiya, that was Madari. Next, National Spinal Injury Hospital. And many of us don't know where this hospital is. It's on Lenana Road, and it's a very critical orthopedic hospital because anyone who has spinal injuries, many of them are referred there for specialized care. So the National Spinal Injury Hospital, on the other hand, is built on a small piece of land with no room for expansion. The hospital also lacks autonomy and faces the same challenges of inadequate staff, lack of equipment, and low funding. Aya, let's go to Moi. Moi Teaching and Referral Hospital in Eldoret, it suffers the burden of serving patients from 21 counties across Rift Valley and western regions of the country. 21 counties is so much. I don't know if you guys just have a mental picture and think of 21 counties, all people coming to one hospital as a referral hospital because it's the national hospital they have access to. Okay. The hospital has relative success in staff management. Oh, that's a plus. That's good for them. Donor partnerships and has a vision of expansion. The hospital also faces inadequate funding and has had to shoulder waivers for indigents. Okay. Then Kenyatta. Kenyatta lacks Kenyatta National Hospital. Let me respect it. Kenyatta National Hospital. It lacks a substantive chairperson of the board as well as a CEO. The hospital is unduly overstretched and has previously faced several crises caused by grossly inadequate funding, industrial action, outdated equipment. If you've been, I did my med school in Kenyatta. Let me tell you, for most of the years that we were there, the MRI was not working. So we had to refer patients out for such a long time. So here they haven't lied. They also have inadequate staffing and they suffer the burden from an... Wow, are you guys ready for this? It suffers the burden from an almost collapsing county healthcare system. The hospital has seen Kura and NLC acquire its land without commensurate compensation. Yeah, so that was a report of the hospitals, the national hospitals we have in our country. And why I'm reading this is just because I want us to understand why our healthcare system has many challenges. So you've gotten to see some of the challenges the national hospitals are facing. And let me tell you for a fact, these challenges trickle down. So whatever you felt at level 6 happens at county level, happens at sub-county level, happens at dispensary, clinic, and even the community level. And that is why now there was the notion to strengthen primary healthcare. So when we're strengthening primary healthcare, what happens is you focus on level 1, level 2, and level 3, because now you don't want to overstrain and overstretch the higher levels of care, which is called secondary and we call tertiary levels of care, of which is what we have currently happening. Like, it was so interesting to see people coming to Kenyatta, which is a level 6 hospital, for a flu. And that time there's someone there who needs emergency access. Like, of course, you'll be treated the last person because your case is not an emergency. So for us to understand the different levels of care that we have, it's going to explain the access points you have when it comes to seeking healthcare, and to tell you for this and this, I should go here. If I need specialized care, probably I need to step higher. If I need more care, then you go to tertiary level. So with all those 6 levels, now it's divided into 3 layers. So take it like a cake. So I'll start from the bottom going up. So at the bottom, we have primary healthcare, which constitutes level 1, level 2, and level 3. Primary healthcare basically deals with your common conditions. If you have a flu, if you have a cold, if you have anything that you're not so certain about, then primary healthcare would be your first point of access. But it's unfortunate that in some of our counties, primary healthcare has not been strengthened. And what I mean by that is you might go to a dispensary or a clinic and don't, I feel like when you talk about health, please don't only think about Nairobi. Think about the outskirts of Nairobi, because the person there also needs healthcare. So you'll go and find that they don't have services to offer you, and that's why you tend to go to now a higher level. Okay, but now when you're going to higher levels, which is now the second layer of the cake, you look at your county and your sub-county hospitals. Now, these are supposed to have some specialized care. So you'll go there, they have gynecologists, they have surgeons, and you can get that type of treatment there. But then now in level 6 is now tertiary care, where it's specialized care, where there's some things that you can only go to a level 6 hospital to receive that type of care. For the longest time, cancer treatment could only be sought at level 6. So your Kenyattas, your not Bagathis, your Kenyattas, your MTRH, which is Moi, KU, etc. But now we have more level 2s, or more secondary levels of healthcare offering cancer treatment. So the higher you go, the more specialized it becomes. And I asked you guys, so what constitutes primary healthcare? And I put specialized care intentionally, and it was an exception. So I was like, what out of these four, which one does not fall under primary healthcare? And you all put specialized care, which is very true. So specialized care is a bit higher. So more of your secondary and your tertiary. So why am I talking about this? Because if you have a flu, if you have a cold, if you have something that's not so certain, you can start with your community level of care. And this doesn't mean that I'm saying you go to the outdated community level of care. There are clinics that are actually very good clinics that can actually help in diagnosing some of these conditions you have and actually treating them. And then they can refer you up. So once they refer you up, then you get specialized care, and it moves like that. So that is basically how our healthcare system runs. Although in private facilities, it tends to work a bit differently. So in private facilities, you can literally walk in and ask to see a consultant, because they're available to you. So their system kind of works differently, but public systems, there's like a channel of care. So you start here, then you're referred to the specialist, and then it goes like that. So those are the major differences between the two. And when it comes to private healthcare, it's a one-stop shop. So like Nairobi Hospital, the Aga Khans, the Avenues, of which would be considered level 6, because Nairobi Hospital, Aga Khan, they're like Kenyatta. So that's like level 6. And you can get all the services you'd need there. So for them, it's a bit different. But for public healthcare, there's a tier to it. All right. So I know you ask yourself this question. Okay, fine. But why do I not get the services I'm looking for in public facilities? And I would say it's just the same thing. The same problems you've had from the report are the same problems you have around. So, number one, funding. They don't have enough funding. And I think devolution kind of changed the healthcare system just a bit. So, previously, everything would go to national government, and funding would come from national government dispersing to the different hospitals. But now, yes, funding still comes from national government, but your county dictates how you're going to use that funding. So, you'd find that you'll go to one county, this county has good healthcare services. You go to the next county, it's not so good. So healthcare is kind of not yet standardized, especially with devolution. But I know it's something they're working, or rather, not they, we are working towards. So something I think that is very nice. Okay, it might not be nice when you're the healthcare provider there and you want to refer a patient, but during COVID or around that time, what happened was we could not do any cross-county referrals, especially if you've reached the county referral hospital. You can't go from one county referral to another county referral, because remember we talked about the cascade. So now you have to go up. You go to a national hospital. And what that does is it makes every county, or rather, the idea is it's supposed to empower every county to equip your facilities to the highest level possible, so that anything that you need there, it's a one-stop shop. And the next thing, if you don't have anything there, you refer to national level. But that's not the case. And I can tell you for a fact, because working in Nyeri, there are times where you'd want to refer to, let me say, like Kipia, but they're just like, but you have a referral hospital. Why are you sending your patients to us? Send to Kenyatta. So I think that has also helped in trying to empower different counties to just try and strengthen their healthcare system, so that you can offer the best for your community. Okay. So I know I need to address something, and that is the challenges that we face in the Kenyan healthcare system, because there are so many. So apart from funding, the other thing is infrastructure. There are very few hospitals that have all the infrastructure that you may need necessary, and that's why you might feel the need to go to this particular hospital instead of this one. So different hospitals have imaging, different hospitals have different tests, different hospitals have different specialists, different hospitals have different cadres of care. And according to our hospital structure, you should have at least a doctor, nurses, then we have auxiliary staff, we have physiotherapists, nutritionists, etc. But bare minimum, you should be able to test, to do simple tests. You should be able to at least do an x-ray. But some of our facilities don't have this, and that's why you find the need to actually go to other hospitals. Something else is staffing. Healthcare is really understaffed in Kenya, and I don't think we understand that. We are really understaffed. And you'd find that many facilities are operating, they're overstretching their healthcare providers. And this is mostly because of the funding issue. Like, you can't afford to employ all these other doctors, because remember, you have a budgetary allocation. So it's like a pull, all push and pull all the time. Doctors saying that we need more doctors, and then hospitals saying that we don't have the capacity. We don't have the capacity. But these are some of the things that actually contribute to our struggling healthcare system. Then something else is access. So access is a word. Access actually now is a buzzword. Put it here. Access. And why am I saying it's a buzzword? Because we have many facilities. True or false? We have many facilities in this country, but can these facilities actually offer you the services that they say they offer? So access has been used, I think, too broadly, but now we need to focus on the quality of access. Yes, you said, I have a facility here, but if I come here in an emergency, will you be able to help me? I remember when I was working in Karatina, there's an emergency doctor from Aga Khan. I forget his name, but he does a lot in the emergency space. And he was trying to map out how many emergency centers are there in the entire county. And guys, according to standards, si ati kusema tu, we have a sign here, casualty, emergency. When they were doing the audit of the cross-check just to find out, can you actually manage an emergency? There were not very many. And that's why you find many facilities are there saying that, yes, we offer this, we offer that. But the question is, do you really offer this? If someone comes in that state, can they actually get the services that they require? So that's another challenge we face, access. Access is now a buzzword being used, but we need to get to the quality aspect of access. Then the last thing we have is patients don't really know. And this is why I'm here. Patients don't really know some of these conditions. They're not empowered to detect that something is going wrong. I need to seek healthcare advice. And you find that many people come a bit too late, and there's a burden now on the healthcare system because there's a lot of money spent on curative care rather than preventive care. And you'd find that when you spend more money on preventative care, the burden on curative care goes down, because now you've detected things early. And I'm not saying that some of these conditions, you won't have them just because you're taking the preventative measures. You won't get cancer, you won't get hypertension, you won't get diabetes. That's not what I'm saying. What I'm saying is, if you're empowered to detect the signs early, you'll be able to seek treatment as early as possible. And you'll find that many of the facilities we have today can support early treatment of certain conditions. So it's when it's at its advanced stage is when we are not really able to treat you or to manage, and you find that many people tend to go to India, etc. It's not just about the cost, but also capacity. Can we manage this condition that you have? So I'm here to empower you guys, because you are part of the healthcare system, and the more you know, the more you're able to help us treat you and treat you as early as possible. Okay, so now, when should you go to a private facility? When should you go to a public facility? That's your option. The choice is yours. But remember, I said if you're answering that question, it's based on privilege. But let me just talk about some services that public facilities actually do a good job in at. Number one, vaccination services. So if you're looking for KEPI vaccines are normally available free of charge in most county facilities, most government facilities. And if you ask me, if I was not to pay for this vaccine, while I go here and they'll ask me to pay, I'll go for the ones that are government funded. And then if there's any other that you might want to add, then you can add on, because there's some vaccines that also are not in government facilities and that you can still get in private facilities. So that's number one, I will give a round of applause for government facilities for their good vaccination services. Number two is women's health. Let me call it maternal and child health care, but also family planning. So MCH, it's called MCH in short. Working in a government facility, I think they really take maternal and childcare seriously. They do such a good job, and this extends also to family planning. So if you've been really wondering where should you go, I'd say just pay a visit. You don't have to use the service, just pay a visit and see what they're doing. They actually do a good job. And I'm for that idea that if you're doing something good, let's appreciate the good efforts that you're putting in, because sometimes you just need that kidogo encouragement and then it spreads throughout. Now, having said that, there are areas where we seriously, seriously need to improve. Number one, we really need to improve in our, let me call it bedside manners. So, when it comes to now the healthcare professionals, we really need to improve in how we manage patients. And you'd find that in private facilities, they're actually very particular about this. They really empower their staff to take care of the patient, to value the patient, and to treat them with respect and to maintain their dignity. In government facilities, you'd find that that sometimes tends to be a miss, and many a times would blame it on the overload of patients that we have. And I know it is a problem. I've worked there, it is a problem, but I think sometimes it just starts with you. It's just that one thing that you do just to find out if the patient is a bit more comfortable than you left them, if they're okay, how they're doing, do they need some assistance. And I've found that sometimes that actually makes a difference in respectful care, because it's not always just about the infrastructure or you don't have this test, you don't have that test. Even just how you treat the patient, you can do such a good job treating the patient well, where they'll feel that regardless of you sending me elsewhere to get maybe this lab test because you didn't have it in the hospital, I was treated well. So I think that is actually one area, and it's a serious area where I think we need to improve as a healthcare facility, not facility, as a healthcare system in general. Okay, so I have walked you through the healthcare structure of the country, and I think for me, where I want to leave us, I just want to leave us at a place where I'm saying that there are many challenges that we have in our healthcare system. There are areas where we've done a good job, it's commendable. There are other areas where we definitely, definitely need to improve. And I think it's good to appreciate where we are putting in good effort. But at the same time, let's always remember that we can do better. And I think this is also just a call to healthcare providers. Please let's treat our patients well. Let's remember our bedside manners, because at the end of the day, you leave a lasting impression on the patient. So you want to treat that patient well and to enable them to be proactive in their health, and proactive in a way that they won't feel like it's a burden for them to come to the hospital again, because you want them to actually be proactive in healthcare choices and decisions that they make around their health. So let's be nice to them. Let's treat them with dignity, treat them with respect, and let's give them the healthcare that they deserve. So yeah, I hope you kind of understood a bit of just the healthcare system that we have. There's so much more that we can talk about, and I don't want to be the one to talk about healthcare systems in the country, talk about health financing, because I know that is a whole different topic. We can get there, but I want you to understand, when we have certain challenges such as the workforce, you see doctors striking, you see interns not going to work because they're not paid, it's bigger than just what they're talking about. The healthcare system in general has really taken a toll on them, and they've reached this point where they're just like, I need more than just, yeah, yes, I'm there, I decided to do medicine, but I'm also a human being. I need to eat, I need to pay my rent, I need to do the things that you're also doing. So at the same point, it's good for me to be paid, and to be paid fairly. Then also something else is, when you go to, I don't want to say public facilities, but when you go to certain facilities and you're just looking at the conditions that are there, you're looking at all the curtains are torn, or one that actually is left in my mind is patients wearing like the torn clothes. It's bigger than that. So you're sitting and just trying to wonder, okay, fine, what is the funding of this hospital? And it's not because they haven't prioritized. What I noticed, especially working in Kenyatta, because we did our medical rotations there, people are really working with what they have. You've given me this, I'll stretch it and strain it as much as I can. And where you can't, then now it'll start to show. So maybe you'll see some torn clothes, some torn bed sheets, some torn curtains, but that is the budget they're working in. And for me, what I saw is they still put their best foot forward. So, why I'm talking about this is because at the end of the day, we are all part of the healthcare system, and our decisions when it comes to policy formulation, policy implementation, we actually have a say in that and we have a role to play. So, the more you know, the more you're able to make an informed decision, not just about your health, but also about the healthcare structure. So, yeah, that was it for today. That was it for today. So, misconception that I'm going to address is not all government facilities are bad in terms of health. There's some services that you will get a good job, and I mentioned some of them that I have experienced. I'm sure there are others, but when it comes to family planning, maternal and child health care, and what was the other one? And vaccination stroke immunization. I think they really do a stellar job and they should be commended for that. So that was it for today. Please, please, please share this with someone who you think may benefit from this. Don't forget to like, to share, to comment, to subscribe, and actually comment. I'd like to hear what are your thoughts on public versus private sector when it comes to healthcare in our country. Yeah. So see you next time and bye.